Good morning. Happy Thursday. I hereby call this the fifth meeting of the House Standing Committee on Families and Children's to order. As a reminder, please silence your cell phones so there are no distractions. Secretary, please call the roll.
Representative Baker, Representative Kleins,
Here.
Representative Decker, Representative Dietz,
Here.
Representative Elliott, Representative Fleming, Representative Gooch,
Here.
Representative Proctor, Representative Rayburn,
Here.
Representative Raymond, Representative Rourks,
Here.
Representative Wilner, Representative Wilson, Vice Chair Riley, Chair Heverin.
Here. The first bill we will hear today is Senate Bill 74. Senator Funky Fromeyer, could you please make your way to the testimony table with any guests? Please introduce yourself, and then I will make a motion for the adoption of the House Committee substitute.
Thank you. Thank you, Chairwoman Heverin, and thank you, committee. My name is Shelley Funky Fromeyer. I'm Senator for District 24.
Mary Catherine Zeloter with the Kentucky Birth Coalition.
Thank you. Can I get a motion on the House Committee substitute? We got a motion by Representative Fleming, a second by Vice Chair Riley. All in favor? All opposed? House Committee substitute passes. The House Committee substitute is actually one of mine, and so briefly I will explain that. It is a cleanup bill from the cabinet that the secretary asked me to run because Senator Funky Fromeyer is also doing a cleanup bill. I thought it would work together just to make sure with the timing of everything. It cleans up a few things with the Department of Public Health, and it also covers the Child Fatality Committee. So nothing that anyone should be worried about, but if you have any questions, I'm happy to answer those. But Senator Funky Fromeyer, I will let you go ahead and present on your bill.
Thank you so much. And I do have the expert sitting beside me, so she'll be here when you ask questions. So Senate Bill 74, as amended by the Senate Committee substitute, really is a result of an excellent meeting that we had in combination with Senator Danny Carroll, Steve Meredith, and the Cabinet for Health and Family Services. We recognized that there were a few edges that needed to be polished, and the two main objectives are both related to maternal health. So the first is that the State Maternal Fatality Review Team, which is known as Maternal Mortality Review Committee, is comprised of 29 professionals from a broad range of specialties. They do review all maternal deaths and produce an annual report. Those summaries often provide the findings and recommendations that we're really looking for. It's from that data that Kentucky maternal deaths can potentially be prevented, and that's our goal. To make the State Maternal Fatality Review Team permanent, with our collaboration with the Cabinet for Health and Family Services, we did recognize some clarifications needed to be made. The statute a couple years back was defined as if they were together, child and maternal. They're not intended to be the same team. They are intended to be two separate teams. So 74 amends also the definition of maternal fatality: the death of a woman during pregnancy and within 1 year of the end of pregnancy, which is consistent with the current work of the Maternal Fatality Review Team. Section 1.7 of the Senate Bill 74 codifies language that already existed in the statute to the local child fatality review teams. The Cabinet for Health and Family Services expressed that it was important to clear that this language also applies to the state teams. Section 1.7 also clarifies that the information gathered by both the child and maternal state fatality review teams shall be privileged and shall not be subject to discovery, subpoena, or introduction into evidence. The second objective of Senate Bill 74 is to make existing data that's already available to the hospitals.
Motion on the bill.
We've got a motion on Senate Bill 74 as amended by House Committee Substitute 1. Your guest is welcome to speak, but as I said last week, if we have a motion and a second, I would hate for you all to say anything else that could change someone's vote. Secretary, does anyone have any questions? Secretary, please call the roll.
Representative Baker, Representative Kleins,
Yes.
Representative Decker, Representative Dietz,
Yes.
Representative Elliott, Representative Fleming, Representative Gooch, Representative Proctor, Representative Rayburn,
Yes.
Representative Raymond, Representative Riley,
Yes.
Representative Rourke,
Yes.
Representative Wilner, Representative Wilson, Chair Heverin.
Yes. The vote passes 11-0 with favorable expression, and it should do so on the floor. Can I get a motion to adopt the title amendment for this? I've got a motion by
Second.
Representative Fleming and a second by Vice Chair Riley. Can I, all in favor say aye? Aye. Any opposed? Okay. The title amendment passes. Congratulations.
Thank you.
Senator Frankie Fromeyer.
Thank you.
And I'm going to pass it over to Vice Chair Riley to do the rest.
Thank you, Chair. The next bill we hear is Senate Bill 145, and Chair Heverin is going to replace Senator Rocky Adams in presenting the bill. So the Chair is now proceeding to the testimony table. And please introduce yourself for the record and proceed.
Thank you, Chairman. I am State Representative Samara Heverin. I represent the 18th District. I am presenting Senate Bill 145 for Senator Julie Rocky Adams this morning. Senate Bill 145 is a public protection measure that is being proposed to establish statutory framework allowing healthcare facilities and providers enrolled in Kentucky's Medicaid program to submit current and prospective employees to a check of the Child Abuse and Neglect Registry or Adult Abuse Registry within the Cabinet for Health and Family Services. Existing law already requires that schools, church volunteers, child care providers, nursing homes, and others to check at least one of these registries. However, our current statutory framework does not allow for other healthcare facilities, such as hospitals, chemical dependency providers, ambulatory surgical centers, community mental health centers, ambulance providers, dentists, and other provider types to check each of these registries. The bill proposed closes this gap.
Motion on the bill.
We have a motion on the bill from Representative Kleins and a second from Representative Fleming. Representative Chair Heverin, I will remind you that of the same advice you give other people when
I'm happy to
we have
answer
a
any
motion.
questions.
But I think we do have a question from Representative Raymond.
Yes, thank you. I'm just wondering about that word "or." I'm thinking that some facilities may want to check both, and I want to make to where they're just checking for child abuse or just checking for adult abuse.
No. As the question was posed on the floor, is this inclusive or exclusive yesterday from Chairman Petrie, I think that this makes it inclusive, that it's one or the other. Sometimes if you use the word "and" in there, they could take it that it would be child abuse and adult abuse. Yeah. And so, or it would be, you would have to have both. And so I think "or" makes it inclusive.
With no further questions, Secretary, if you could please call the roll.
Representative Baker, Representative Kleins,
Yes.
Representative Decker, Representative Dietz,
Yes.
Representative Elliott, Representative Fleming, Representative Gooch, Representative Proctor, Representative Rayburn,
Yes.
Representative Raymond, Representative Riley,
Yes.
Representative Rourke,
Yes.
Representative Wilner, Representative Wilson, Chair Heverin.
And the bill passes 11-0 with favorable expression. Thank you, Chair Heverin. Proceed to the next.
Thank you. I don't know what's next on the agenda. Is House Joint Resolution 116?
Yes, it
House?
is.
Okay. Thank you for your grace, Mr. Chairman. So House Joint Resolution 116 is a joint resolution to direct the Cabinet for Health and Family Services to evaluate and report on services offered to children in out-of-home care settings. I think, as you all have recognized, is that when I took over when I I began to chair families and children, this has been one of my top priorities, as we've talked about probably each interim joint committee meeting and several times during session as well. And so what this does is it directs the cabinet to conduct an external audit and review of current requirements related to training for residential care organizations. It develops practices and procedures that would increase the opportunities for youth in residential and institutional care. It would designate a study group to make recommendations regarding the creation and implementation of performance-based funding and contracting for licensed child care facilities and child placing agencies in the Commonwealth. It would also develop practices and procedures related to the long-term effects of psychotropic medications. The last part came, I actually had a group of foster care kids come to me, and I was just asking them what are some issues that they face. I think it's really important that when we make legislation, we're talking to the people. And so during that time, they said that a lot of times as they go from home to home, they might get put on a medication and there's no follow-up. And I know how important it is for me to have follow-up, with my doctor on any type of medication, just as it would be for you all. And so I really want to evaluate that and make sure that when our kids in foster care are placed on medications, that they are getting follow-ups. I think all of these things will be great next steps for us to continue our conversations of how to make sure that our kids are taken care of in Kentucky. So, Mr. Chairman, if there are any questions, I would be happy to answer them.
Representative Works.
Thank you, Mr. Chair. I just have a quick question. I know the report is required by November 1st of this year to the LRC. And I know this is we need this information quickly. Is that enough time to do a robust examination of the stakeholders at play and to get that turned around in time? But I also understand that it's very much needed and urgent. So
yeah, I really think there are. I think some of this information we probably already have. It's just not being reported to us, which, I know that the cabinet's going to be able to provide that to us. It is time is of the essence. And I've been beating this drum, Representative Works, for almost 2 years now of how do we do better job in Kentucky. As you know, in several meetings we've had, and several stakeholder meetings we've had outside of the interim joint committee hearings, how do we get kids off the floor of foster care? And if this increases their speed a little bit, I think that it's worth it for our kids of Kentucky.
thank you.
Motion for adoption.
We have a motion from Representative Elliott. A second from Representative Rayburn. Secretary, please call the roll.
Representative Baker, Representative Kleins,
Yes.
Representative Decker, Representative Dietz,
Yes.
Representative Elliott, Representative Fleming, Representative Gooch, Representative Proctor, Representative Rayburn,
Yes.
Representative Raymond, Representative Riley,
Yes.
Representative Rourke,
Yes.
Representative Wilner, Representative Wilson, Chair Hebron.
Yes.
House Joint Resolution 116 passes with favorable expression by a vote of 11-0. And at this time, we will keep Chair Hebron at the table and hear House Concurrent Resolution 117. And please have any of your guests come up. Representative Hebron, if you could, please introduce yourself for the record and your guests.
Yes. I am State Representative Samara Heverin. I'm still the representative of the 18th District, and I will let my guest introduce herself.
I'm Norma Hatfield. I'm president of the Kinship Families Coalition of Kentucky and a grandmother raising 2 grandkids.
Thank you, Mr. Chairman. So what this concurrent resolution does is it establishes the Kentucky Kinship Task Force. I'm sure you all remember during the interim at the state fair, Norma came and discussed about her role as a kinship caregiver. And so we've had a lot of great conversations over the interim, her educating me and me educating her on the legislative process. And it's been really, it's been a great conversation. Norma is a constituent of Hardin County. So I think as you all recognize, it's always special to be able to work with constituents and representing our own communities. What the task force would do, it shall study, review, and make recommendations regarding the current and future policy needs of the state to address access and availability of kinship care to the citizens of the Commonwealth. And it goes on to give specifics. I think that Senator Julie Rocky Adams' bill that we passed last week is a really great start, but I do think it's a conversation that we must continue to have. You know, I think on my list today, I forgot to share, but there are over almost 8,000 kids in out-of-home care. And so we've got to make sure, you know, if we can get those kids with family members, we've got to try our best to do that. And so I think I really appreciate Norma bringing this suggestion to us, and I will let my guest speak if she has anything to add.
Just that there are a lot of needs out there for kinship families. There are a lot of families that didn't qualify for the old kinship program. They missed the window for relative foster care, and they are struggling, and they're taking care of a lot of kids here in Kentucky. And so this task force, and I'm so grateful to Representative Heverin about this, this task force is going to help identify what we can do and get the information, the data out there, so that we can figure out how to do better for the kids.
We'd be happy to answer any questions if anyone has anything.
Okay, any questions?
Motion.
If not, we need a motion.
A motion.
We have a motion on House Concurrent Resolution 117. Second? Second by Representative Rourke. The motion was by Representative Kleins. Secretary, please call the roll.
Representative Baker, Representative Kleins.
Yes.
Representative Decker, Representative Dietz.
Yes.
Representative Elliott, Representative Fleming, Representative Gooch, Representative Proctor, Representative Rayburn,
Yes.
Representative Raymond, Representative Riley,
Yes.
Representative Rourke,
Yes.
Representative Wilner, Representative Wilson, Chair Hebron.
House
Yes.
Concurrent Resolution passes with favorable expression by a vote of 11-0. The next scheduled meeting of the House Standing Committee on Families and Children is on Thursday, March 14th, 2024 at 9 a.m. in room 171 of the Annex. Thank you. Thank you, everybody. Motion to adjourn? Got a motion to adjourn and a second. Thank you.